Another way we can talk about joints is by the type of articulation between the bones. In plane joints, we have flat articular surfaces. These joints move non-axially. These are your gliding joints, the carpals, the tarsals, and the vertebral joints. Hinge joints have a cylindrical projection that fits into a trough. This can only move in one plane. They're uniaxial. They can perform flexion and extension, so this is the elbow and the knee. And then pivot joints have round ends that fit into a ring. These are uniaxial joints. They can move in only one plane. Rotation occurs with these joints. We have a pivotal joint between the atlas and the axis in the neck. So here you see plane joints between the carpals, smooth edges that simply glide over each other. Here is a hinge joint, that cylindrical piece that fits into the trough. This allows for flexion and extension. And this is a pivot joint. Here we see the radius in this ring or this ligament. This allows for the radius to rotate on the ulna. This would give you the pronation and supination of the hand. Condyloid joints or elliptical joints have oval surfaces that fit into an oval depression. They're what we call biaxial. You can move in two planes. They can perform all of the angular motions, flexion, extension, abduction, and adduction. The knuckles and the radiocarpal joints have this kind of movement. The saddle joint has two surfaces that are both convex and concave. They have biaxial movement, flexion, extension, abduction, and adduction. They're called saddle joints because it looks a little bit like a rider in a saddle. You have two saddle joints, one in each thumb. This is what allows for the opposable thumb. This is why you can twiddle your thumbs or grip anything between your thumb and your fingers. And ball and socket joints have a spherical end that fits into a socket. These are multi-axial. They can move in all directions. This has the greatest range of motion. This is what you see in the shoulder and the hip. So your condyloid joints, like we see in your knuckles, have this oval articular surface. The saddle joint, the rider in the saddle, this gives you extension, flexion, abduction, and adduction. And then the ball and socket joint, where you have a ball fitting into a socket. And this gives you flexion, extension, abduction, adduction, rotation, and circumduction. Gives you all of the movements. Your knee is your largest and most complex joint, and it's very vulnerable to horizontal blows. Your knee is only supposed to flex and extend. When you try to make it abduct and adduct, you void the warranty. Injury to the anterior cruciate ligament is the most common injury. This is the ACL. Repair of this ligament usually involves ligament grafting. So seeing the knee joint, here's the patella, it's been reflected back. We've got the joint bent, so you're seeing the condylar surfaces. Here are the menisci, those extracapsular lateral ligaments. And here is the anterior and posterior cruciate. And the anterior, because it's on the outside, is the one that typically gets torn when there's some sort of blow from the side. This is an X-ray with a normal ACL, and here you can see where the ACL has been torn. Other homeostatic imbalances include damage to the cartilage. Cartilage rarely repairs. It tends to stay torn because cartilage is avascular. Arthroscopic surgery can remove cartilage fragments that may hinder joint activity. When this happens, the joint is less stable. Meniscal transplants may be done in younger patients to help keep their knee stable. One day, perhaps we'll be able to grow meniscus from our own stem cells. Now here we see the femur, the tibia. This is that meniscus, and here is the tear in the meniscus. So these cartilage fragments could impede joint activity. A strain is when there is damage to any of the joint tissues. There is swelling and inflammation, and typically this is best treated with rest, ice, compression, and elevation, or RICE. Sprains are when the reinforcing ligaments are stretched or torn. If the ligaments are torn and they're only partially torn, they will heal, but they heal slowly. There's very poor vascularization to your ligaments. If it's completely torn, there are three options. They can sew the ends together, they can replace with grafts, or they can simply immobilize it and hope that time takes care of it. Dislocations or luxations occur when the bones are forced out of alignment. This is accompanied by sprains, inflammation, and difficulty moving the joint. Usually serious falls or contact sports are responsible for most dislocations. In order to treat these, it's just like a broken bone. They've got to be reduced. You've got to put the bones back into alignment. A partial dislocation of a joint is called a subluxation. Now this is an x-ray of a dislocated shoulder. Here's the glenoid cavity and here's the head of the humerus, and it should be up here. So here we would have to pull on this to get this popped back into place. Your shoulder joint is the second most commonly dislocated joint. Your jaw joint is the most easily dislocated joint. Bursitis occurs when there is an inflammation of the bursa, usually caused by either some sort of blow to the tissue or friction, excessive use of the bursa. This is treated with rest and ice, and anti-inflammatories may be used. Tendinitis is a similar condition, but this time the inflammation is of the tendon sheath. Typically, this is caused by overuse. Same kinds of symptoms, lots of pain when you use the joint, and it's treated similarly. Rest, ice, usually some inactivity for that area, and some anti-inflammatories if that helps. Arthritis is a collection of inflammatory or degenerative diseases that damage the joints. There are over 100 different types of arthritis. Arthritis is the most widespread crippling disease in the United States. Pain, stiffness, and swelling of the joints are the common symptoms. Acute arthritis is typically caused by a bacterial infection which can be treated with antibiotics. Strep throat and gonorrhea are two bacterial diseases where the bacteria can spread to the joints and cause bacterial or acute arthritis. The most common chronic forms of arthritis are osteoarthritis, rheumatoid arthritis, and gouty arthritis. Osteoarthritis is the most common form of chronic arthritis and is usually referred to as wear and tear arthritis. Normal use of your joints release enzymes that break down cartilage. When you're young, your cartilage replaces almost as fast as you break it down. As you age, that cartilage replacement slows a little bit, and so you begin to wear away the cartilage. Osteophytes, or bone spurs, may form from the thickened ends of the bones. Where the cartilage degrades, you will have edges, and those will ossify. Bone spurs make joint activity difficult. Usually this kind of arthritis is not crippling, just painful. So here you see where the cartilage has been eroded away and we have exposed bone. And osteophytes will develop here on the edge of the cartilage. So here you see bone spurs. You can imagine as you try to bend that particular joint, you're going to have those bone spurs affect that movement. Rheumatoid arthritis is an autoimmune disease. It's chronic and inflammatory. We're not sure what starts autoimmune diseases, but it may be a bacteria or a virus that really causes no symptoms, so we don't know we've had it. As the synovial membrane becomes inflamed, a pannus develops, a thickened membrane. This irritates your immune system, and immune system cells come to the area to destroy the pannus and end up eroding the articular cartilage. Scar tissue starts to form, and this ossifies. This fuses the joints together. This kind is the crippling kind of arthritis that deforms the joints. People with rheumatoid arthritis have bilateral affliction. That is, if they have it in the right hand, they're going to have it in the left hand as well. And typically the small joints in the fingers are the first that are affected. Here you see a hand that has been affected with severe rheumatoid arthritis. You can see how all of the joints are deformed. This is painful, and the hand is also dysfunctional. In gouty arthritis, uric acid crystals are deposited in the joint. Uric acid is a breakdown product from protein digestion. Typically, it is eliminated in the urine, but some people lack the enzymes for this to happen, and as the uric acid crystals collect in the blood, they get deposited in the joint. This will cause an inflammatory reaction in the joint. Usually the great toe is affected first. Other joints may be infected, but usually it's the great toe. There are medications used to treat this, but they are toxic to the liver. People with arthritis may have some success controlling it if they reduce their alcohol consumption and watch their diet. Certain foods are more likely to give up uric acid than other foods. Lyme disease is caused by the bacteria Borrelia burgdorferi. This is transmitted by a tick bite. Symptoms include a bullseye skin rash at the site of the bite, flu-like symptoms, and foggy thinking. This organism can cause damage to the joints and to the heart, so joint pain and arthritis may be symptoms of Lyme disease. This disease, since it is bacterial, can be treated, but it's a relatively long course of antibiotics. Unfortunately, any heart damage or joint damage you experience prior to starting the antibiotics is permanent. Since your joints allow for movement, it's important to try to keep them healthy. Generally, joints function well until late middle age. Ligaments and tendons begin to shorten and stiffen and weaken. This reduces flexibility. Stretching kinds of exercises like yoga can prevent this from happening. Intervertebral disc rupture is most likely to happen as you age. Again, if you're carrying extra weight, this puts a lot of stress on those discs. And if you have a job where you have to do a lot of heavy lifting and you're not careful about how you lift, you may rupture discs. Most people have some degree of osteoarthritis by the age of 70. Exercise can be very helpful in keeping your joints healthy. It helps keep those ligaments and tendons from shortening. It keeps the joints loose. It keeps blood flowing there, and that's going to keep the chondrocytes active so they'll repair cartilage better.